Good morning from Baton Rouge General Foundation President Eric Showalter. I'm here with Dr. Stephen Briere, one of our physicians in the ICU who's on the front line. We wanted to give you an update on what's going on here at the hospital from someone who is there and seeing it, and also talk about some of the needs that he's seeing as they're evolving day to day. So Dr. Briere, thanks for joining us today.
Good to visit with y'all. Thanks to everyone in the foundation for all the contributions you've made so far. I'll just give you a quick update of what's going on in your ICU units and what we've done to try and respond to this crisis in our community. First off, you should be very proud of your employees, your nurses, respiratory therapists, nurse managers, EVS. Everyone has stepped up big and they're working very, very hard for you and for our patients. It's been very heartwarming to see what they're doing. Additionally, your critical care physicians are all on board. We have all hands on deck and all patients are being taken care of. Families are being communicated with daily. We've expanded the ICUs from 24 ICU beds, which is our normal operating capacity, up to 68 with a couple reserve beds that we can surge above that in case of a crisis. Of those 68 beds, 12 are now dedicated to non-COVID patients, the rest are COVID patients. 53 of those beds are currently occupied. About half of the patients in there are on mechanical ventilation at the current time. We're providing adequate care to all of our patients. They're receiving the best care they possibly can, even though we've had to change our nurse staffing ratios. We've developed a system of nurse staffing where we have buddy nurses so that ICU nurses can now care for more patients than they do in usual crises.
So as we are engaging with our donor base, and I know the more we engage with our physicians, how fluid the situation is, the needs change constantly, and we're doing our best to keeping the funds flexible to make sure you can get what you need as those needs arise. And I know that's an important thing for you.
It's been integral to us being able to expand what we've been able to do at this point. You know, we've added ICU beds incrementally as we've gone through this process over the past 3 weeks. So now where we initially started with 1 ICU, we now have 5 ICUs that are operational. With each of those comes expenses, and those expenses are related to all the supplies that we need in there, the PPE to make our nursing staff feel safe, and to ensure that we do not propagate the virus at all across our community. So the foundation has been very helpful and integral in us being able to expand the services we provide to our community.
Thank you, Dr. Briere, for your time. Let's get back to work. We appreciate everything. Thank you to our donors. Thank you to everyone as we continue to do things here at the General to keep our community safe and our physicians and our care teams safe and supported by all of you. So thank you so much.